you really can feel like cattle moving through a chute in the healthcare system. It incentivizes volume over outcomes. There's literally not time in the system. It's spending 7 minutes with each patient instead of, 20 minutes. There's 200 plus patients coming every day through the emergency department in a 24-hour period. And are you actually helping any of them get well? The system itself is designed in a way that's going to keep people sick and keep them more and more dependent. It became very clear that the discussion of value was very different from what I thought value should be.
Well, welcome back to our next episode of Patients Win. I'm your host, Jonathan Bushman, and my co-host, Troy Reichert. We have a fantastic guest today, Jordan Cash. Jordan, we go back a few years.
I don't like saying, how many years at this point, but yeah, I
Okay.
mean, we're pushing like 15 years, I think, of when we originally met.
Wow.
We are. And so interestingly, it's a different conversation with you today for multiple different reasons, because number one, you're not my boss. Okay. So Jordan and I met when I was a first year resident in Enid, Oklahoma, where I still continue to practice. And he was a practice management director for the health system in which our residency was housed, and got to know him really well. And I will say this, and it's not because you're right here. I've told people this off air without your face around. I've said, you're my favorite administrator I've ever had.
Man.
And the reason I say that is because you were always real. You always told the truth. And you said no when you needed to say no, instead of dragging us out and letting us believe something was going to happen. And you have no idea as a physician how important that is for someone that you look to lead your organization, to just be straight with you, just to be transparent. And we always knew how you felt, and you were very clear about it. So for that, thank you. You made my first couple years in residency good, and gave me hope for the people I'm working with. So welcome to the show, and we're excited to hear your story, because your
Right.
life has changed in quite dramatic fashion as well. And we've kind of stayed in touch over the years, and I'm anxious to hear kind of your background into healthcare administration, and then what your journey looks like. So get me started a little bit, Jordan. Tell me, how did you get into healthcare? What did your early career look like, and why did you get into healthcare?
Yeah. So first of all, thanks for the kind words, and really appreciate you having me on as a guest. It's something I'm very passionate about, healthcare and changing the way healthcare is delivered. And so any opportunity I get to speak on that, and weaving in a little bit of my personal history and experience isn't something I usually spend a lot of time talking about, but I'll do my best today. I'll be just blunt and honest. I was going into, finance and banking when I was graduating high school. I'd worked at a bank since I was 16, and that was kind of going to be my career path. And I actually had a significant health event of my own at that age of 16 that kind of redirected my purpose and also knowledge. And so one thing I learned very quickly was how critical local healthcare, especially in rural communities, was. So Dr. Bushman, I think one of the things you probably know about me as well is I've always been really passionate about rural healthcare. And so one of those reasons is because I grew up in a small town, and I know there are a lot of small towns in the areas of Oklahoma, and I'm in Arkansas now, same thing, but where healthcare really is a luxury in some places, or it does not exist at all in some places. I have family that live, 45 minutes or more from, a hospital, and maybe not even one I would recommend that people go to. And so when I, at a very young age, saw how much my local healthcare team, hospital healthcare system meant to the community, how much they supported the community, what an economic driver it was, everything else. It really drove me to ask questions of I love which I'm looking at your background that says never stop asking why. Is well, why not? Why can't I do something in business that's
Mhm.
associated with healthcare? And so I met some great leaders and mentors in the healthcare field, and next thing you know, I was hooked and changing my focus and direction to getting a master's in healthcare administration.
So when you did that, what did you think at the time when you first got into health? What
Yeah.
did you think healthcare leadership was?
So I think it was
Idea.
probably what I've been actually told many times from, just people who are, in the community. Well, I thought doctors ran the hospitals, or I thought
Right.
I didn't know that you could, be a in leadership in a hospital. Don't the nurses or the physicians, lead that? And so I'll say that, growing up, that 0 to 16, I never once thought, oh, there must be a healthcare administrator who may be helping with operations or strategy, or leadership within the hospital setting. And so it really was like a wide opening or awakening to the fact that a career path even existed, because I just didn't have any awareness to it. And so I've loved that now being in healthcare for, over 20 years now, is educating and informing and encouraging people who are passionate about health. If you're not like super sciencey, or you don't want to go, deal with, surgeries or blood or anything else like that, you can still find ways to be impactful in healthcare without, being truly clinical. And so to me, it was neat to kind of open up a different world and opportunity that I didn't even know existed.
So your aspiration was not to be a doctor, huh?
Well, it's not that it would never have crossed my mind, but I've always just had a passion for business, and
Mm.
in fact, my first grade teacher always loves to tell stories. Like math was just my like focus. I loved it. I really enjoyed looking for opportunities, to um, be creative in solutions, and science was okay, I guess, but I really enjoyed, that business, financial, and strategic side, and so I always kinda leaned that way.
Hmm. So this is interesting, because I share the same love for math and I like business for that reason too. Like you can think very critically and through the numbers and everything. But um, I'm curious. Take me a couple questions. Take me through what the various roles were over the course of your tenure with a larger health system. Kind of the maybe the structure of the system if it's necessary, and then maybe those moments in time where looking at the spreadsheets, looking at the numbers, and looking at the mission statements, uh, left you with more questions than answers.
Yeah. So one of the things I don't think a lot of people know either is, you mentioned, us meeting during your residency. They actually offer for healthcare administration a residency or fellowship after a degree program, or integrated within a degree program. So my first job out of that healthcare administration master's was actually being an administrative fellow or resident in North Carolina. I worked
Mm.
for Moses Cone Health System. It's now just Cone Health System. But back then in Greensboro, North Carolina, and then I moved back to Integris. The goal was always to come home and be in Oklahoma. And so when I had an opportunity to be a part of Integris, largest nonprofit health system in Oklahoma, at least at that time coming in, it was just a great opportunity. So my wife and I moved back to Oklahoma and started working in healthcare leadership and at Integris Grove. And my role there was, actually, it was amazing. It was one of those opportunities where you say, "I cannot believe they let me do this," but I was, I think 26, 25 or 26, and I was an assistant administrator, and we were building a, 58 bed brand new hospital, and the president, said, "Hey, you get to be involved in this." I was meeting daily with the contractors, the engineers, the architects, the everyone, the vendors to help outfit the capital purchases for the entire building. At the same time, I was leading all the ancillary departments of the hospital, so radiology, physical therapy, even housekeeping and dietary, pretty much everything that was non-nursing, except for practice management. And then that came a couple of years later. So as I continued to grow within the health system, I got more and more responsibilities, and I got additional, things like, again, practice management, cath lab, new departments added to my roles. And so did that for many years, before moving on to Enid, as you mentioned, Dr. Bushman. But for me, one of the things that I quickly learned, to get back to your question about not lining up necessarily with mission statements, it became very clear that the discussion of value was very different from what I
Mhm.
thought value should be. And so what value really is production, or, RVUs, or protocols. And so one thing I noticed more and more was, you really can feel like, cattle moving through a chute in the healthcare system, and there's very little time for individual distinction or practice or decision making. And it's not necessarily because people don't want to, it's there's literally not time in the system. You'll hear me talk a lot about the system itself being where the failures occur, not in the individuals delivering care.
Mhm.
I believe that the heart and the mission and, the intention of people and organizations is great. I think it's just easy to get sidetracked, trying to grow, trying to offer new services, trying to recruit more physicians and services and all those wonderful things. And to do that, you kind of have to play that game. And I'll probably talk a little bit more about that as we get moving on. But there's a lot of games that are played in the traditional system that don't really advance or enhance, patient outcomes or the delivery of care.
So, Jordan, did you see where basically there was a separation between the RVUs and the protocols where literally the patient got lost because it was no longer about the patient, it was about the process?
Yeah, I think that's well said, Troy. And the RVU system. I actually did a podcast last year, kind of breaking down how hospitals, how physicians get paid, and why, and how the average customer or patient has absolutely no clue, and could never really understand the, you know. Hundreds or thousands of different codes that go
Mhm.
into
Right.
the billing process. But it incentivizes volume over outcomes. And even though there are programs that exist now that really didn't exist when I started in healthcare administration, some of these value-based programs do exist now, but they're still a small percentage of the overall, compensation models. And there's a lot of game playing that occurs even within the value systems. And so if I'm a provider, or if I'm a hospital, the bottom line is my best chance at being, successful is more. It's volume. It's always volume. And so if you're a surgeon, it's, operating more. If it's a, primary care doc, it's seeing 35 to 40 patients instead of 20. It's spending 7 minutes with each patient instead of, 20 minutes. And so it's just one of those things that over time you learn quickly that the system itself is designed in a way that's going to keep people sick, and keep them more and more
Mhm.
dependent.
Right.
Yeah, I think it's interesting, and you keep saying system, and I'm thankful that you are because we've shared a common employer, and we've worked with phenomenal people. I have so many great things to say about the Integris Health System and the people involved, the leadership, the nursing, the doctors. Overall, top to bottom, just fantastic people with hearts for care, hearts for people. Um, but that doesn't mean they don't get lost in it. But yeah, that system is driving it more than necessarily the people within. And so, like, what was your experience? And take me a little bit further because you've touched on maybe sort of the earlier career of where you were. Take me a little bit further in what types of ranks you went up in. um, over time, but then also where perhaps what you saw and what you wanted to accomplish was undoable, maybe for system dynamics.
Yeah, that's great, and you know, I knew that I loved working with physicians, so I think that was something that I was pretty passionate about. I
You're
felt like
welcome. You're welcome, Jordan.
well, it's one of those. One, I enjoyed. As you think about like the actual delivery of care, like I would tell, employees, even when I was a hospital president or, system executive, I was, quick to point out, I didn't want physicians to have like the enormous heads or think like God complex or anything else like that. But I did obviously like I can't admit a patient. I can't order a protocol. I can't, be the one who orders this referral for a, specialist or for someone to get a CT scan or MRI. The physicians were the ones who were going to be driving, that care and that volume. And so to me, it was like, there's no denying we need to work extremely well with physicians, and we need to have partnership, and we need to have collaboration, and we need to get their input. We need to get their opinions of what the strategy should be and how we can be more efficient and optimize our performance. And so for me, physician engagement was always something I always just really enjoyed. So even when I moved from those practice management roles into a hospital president role, I still prided myself to be incredibly active and engaged with the physicians. And so even though my role became more global, more strategic, more aligning with system purposes and values beyond even my individual hospital or growing services in the communities that we served and the markets that I was in, I still wanted to be very community connected and very physician. And when I say physician, I, I add advanced practice providers because I think there's an enormous need and role, and we cannot do healthcare without physician assistants, nurse practitioners, from an anesthesia standpoint, CRNAs. I go down the list. There are so many amazing healthcare providers. And so physicians, advanced practice providers were always a heart for me. When I started like rising up, I guess, within the health system, moved to a larger hospital in Oklahoma City to be a president, our second largest in the system at Integra Southwest Medical Center. I loved it. It was one of those where I felt every day we were truly needed for our community. It was one of those
Mhm.
where you could wake up every morning and know it was critical that you were there and that you were doing your job to deliver services for people. At the same time, you have that, thought in your mind where there's 200 plus patients coming every day through the emergency department in a 24-hour period. And are you actually helping any of them get well?
Wow.
And those were questions where it started to really bother me. Again, we were providing great care, and I say the healthcare system, go back to the system, actually works incredibly well in an emergency state. If you have a broken bone or if you need your gallbladder removed, the system is pretty great. I mean, the
Right.
access we have is better than almost any country in the world when it comes to those things. Insured, uninsured, go down the list. That is where the system is really strong. But as far as someone coming in and having something going on, I always say if it's digestive, energy, heart, sleep, those different types of things that aren't just like quick, easy fixes. That's where our healthcare system is really
Mhm.
missing the mark, and it really comes down to that time, and it comes down to that focus and intention in the way the system is structured and designed. And so it was really at Southwest where I was very passionate about what I was doing and excited about it and glad we were there. But then I also was like, man, we are really running cattle through this system. And I began to ask myself, is there a way where maybe we see less patients, but we make greater impact that actually improves their health and maybe even their family's health and multiple generations worth of health? There's so much education, there's so much purpose, there's so much just passion in that for me that I began to at least question a little bit more, what can we do? What other solutions or programs or services can we do? And then from there, we restructured the organization, and I went into a system leadership role where I was over clinical programs across the entire state. And it was very much about, growth, on those service lines. It was very
Mm,
much around, how do we, be cutting edge in technology and services and all these different types of things. There was a lot of discussion about value, but again, value was different in my mind than
right,
what we were really measuring and how we were going about that. And I only served in that role for about a year and a half, and then the opening came up at our largest hospital in the system, Integris Baptist, to be the hospital president, or they called them chief hospital executives at that point. And I felt there was no way I could pass that up. I wanted the opportunity to work
right,
with
right,
the transplant programs and, the advanced heart failure clinics and, the ECMO services. And I mean, that was the one thing. I'd been in rural healthcare so long, and I'd, been at, exciting facilities, but man, to feel like I was at one of the most well-known hospitals
right.
in the region, and to be able to have the chance to lead and work with those physicians, I was really excited. Uh, at that point, we had already started our direct primary care and functional medicine clinic in Arkansas, Salt Health,
Mm,
and I'd partnered with my wife and a physician, Dr. Herbst, to start Salt Health. So at that point, I was already a little torn because
right,
my long term goal was going to be is, well, how do I impact healthcare? How do I change the direction of how it's delivered over a larger scale? But then I was in the belly of the beast of, Integris Baptist at the same time. And so there was definitely a lot of conflict for me there. One of the things that I'm probably most proud of is nearly everyone in the organization had no clue that I had started Salt Health with our partners. They would have told you without a doubt that I was giving 100% always to Integris and to the community and to our teams and to our patients that we served. And so when I told everyone I was leaving, there was full blown shock. And our website in Arkansas had an unbelievable rising of website views because everyone was trying to figure out what the heck I was leaving Integris to go
right.
do in Arkansas, because no one had any knowledge or awareness that, we had anything like that happening.
So Jordan, you're at the peak in your field. You're the president, the chief hospital executive there. You wake up every day with a sense of great purpose. You're having great impact on people because of the systems you're overseeing. And at the same time, you feel this almost disconnect. You feel this discontent to the point where you start something else because you want to impact people in a different way. Tell us a little bit about that mind shift for you, because again, you're at the top. You are doing great things, being successful, and yet you're recognizing there's something missing. What was that?
Man, that's an amazing question, Troy. And it's not a simple answer, but
Mm-mm, no.
it goes back to that recognition that I kind of referenced back when I was at Southwest. Um, I'm very passionate about people actually getting healthy, and I think that
Mm,
was the thing. When you have something amazing like you're able to deliver, a transplant for a patient, our amazing team,
right.
the physicians and advanced practice providers doing amazing work in that space.
Right.
There's a real sense of purpose, just like you said. You're like, man, not many people, have access to this or have the ability. We're changing that person's life, their family's life. We're giving them a second chance. All of these wonderful things. There were a lot of moments like that did exist in the traditional system and in that role. But again, the more frequent activities that occurred throughout, most outpatient visits, most, diagnostic testing, all these different
Right.
types of things. It's all about the precision of coding, documentation, referrals, playing the games around, value-based care programs or documentation for Joint Commission or CMS. Uh, you add up all those things, there's a lot of
Right.
frustration and disconnect that
Yep.
occurs. And after 15 years of working in that environment, it's pretty easy to reach a breaking point where you're like, man, there has got to
Right.
be, a way that you can cut out some of this red tape, work directly with care teams, build a environment that is truly patient-centered.
Right.
We talked a lot about, patient-centered care, but how can you be patient-centered care when you're, averaging 6 to 7 minutes in a visit with them?
Yep.
My physician partner now, she loves to give the example, somebody come in with high blood pressure, and in the traditional setting, you check out their
Mhm.
high blood pressure symptoms and reasons, and you give them a medication and probably send them to a cardiologist for referral, and you just have that path. Well, you didn't have enough time to even find out that, maybe they were, nearing a divorce, and
Right.
that the reason that they're in that state is really more stress driven, and it's something that could be managed or under control with just some active engagement, listening and true care. And so we get to do that now in the system, whereas, you know, Dr. Bushman, you'll be able to add on to this. There it's real that administrators, practice administrators will come to you and say, "Hey, you're not sending very many referrals to the orthopedic surgeon, to the
Yeah.
cardiologist. We need
Mhm.
are you sending them out? What are you doing? Like, we need those people,
Right.
running through that." And you're like, "Well, do they though?" And like, I love to say cardiologist is the perfect example. I saw a study, it was like 40% of what cardiologists see in their clinic every day could and should be managed by primary care. And the
Wow.
cardiologists actually want that. Like,
Right.
they truly
Yep.
and genuinely would prefer to have all of their visits or more of their visits be aligned with that more
Mhm.
complex,
Right.
cardiac care, and not be dealing with the things that primary care, can manage, but primary care doesn't have time, and they're
Have time.
incentivized to move them through that system.
Yep.
Mhm. Absolutely. Yeah, we could go, all day long on that one, Jordan, in terms of the differences. And, there's something that from a provider's perspective in a direct care fashion, there's something emotionally different about it that cannot be explained. You couldn't have explained it to me before I went into it, and I would have felt it yet. Because the difference in that visit, what you're talking about, Dr. Herbst taking the extra time to ask those
Right.
extra questions. And I don't think the general public, and this isn't, one of the things I never want to do is lead to any distrust of the system. Okay. Don't distrust physicians or distrust the system, but it's okay to understand there are some incentives. And if the business model, the system, if you will, business model is incentivizing you to be direct, make the decision, make the medically complex decisions so that you have the right coding and billing so you can keep moving and you've only got so much time, or you're already 30, 45 minutes behind, and what feels like a lot of time with the patient is really the tension you're feeling because you're behind and you have so much
Mhm.
to do. And I've heard physicians say, "Man, I spend so much time with my patients." I'm like, "You see 30 a day. There's no way. I've lived that life. There's no way. It does feel like you're spending time with them. But hey, what's going on in their kids' lives? What's going on in their work life? What's going on with all these different things?" And that for me in the last 7 years has been the ongoing epiphany of there's so much more. Um, Now, I could speak of this for myself, but I'm really curious as a hospital executive coming out of this role, you've continued to do this, right? And anyone who knows you, Jordan, knows that your talents are great. Your experiences, your ability to connect, communicate, and lead people is phenomenal. So I'm sure that that increase in website ticks came out of people scratching their heads, right? So what number 1, what was the hardest thing about leaving? And what did
Mhm.
people assume about your decision to leave?
Oof, whoa. That's amazing. I've never been asked this, in a public setting. I mean, obviously private. Um, I think, again, I love, like, my family, my community. I love being able to be the best version of myself.
Mhm.
And when you are working with the stress and the number of hours, and we've talked about the constraints and the structure for physicians and providers in the system structure, but it's like that way for admin as well. I mean,
Right.
it's truly 24/7, and you have teams and amazing people to help support. But I mean, I was always on call. I mean, 100%. I mean, pretty much for 15 years, always on call. I mean, I'd be the guy on, vacation or, sitting in the, airport, sending out, more emails or jumping on, Teams calls or whatever else it may be, because it's, and I'm structuring vacations around, well, I can't go this time because my board meeting is this part of the month. My, physician executive meeting is this part of the month. My executive leadership team with the other hospital presidents is this month. And so everything that I did, was based on this structure and system and
Right.
schedule, that over time it does absolutely wear on you. Now, could I have done it for longer? Absolutely. There's no question about it. But I did ask myself, can I do this 20 more years?
Mhm.
Can I do this
Right.
25 more years? And the hardest part, I mean, obviously, was, from a compensation standpoint. I mean, there's a lot of security, in having retirement plans and life insurance plans and, executive retirement plans, all these wonderful things, bonus incentives and all that great stuff. So from a compensation standpoint and for my family, that was a huge decision. I mean, it was one of those deals where we
Right.
had to pray about it and talk about it a lot before doing that. But my wife and I were adamant that the most important thing was, us fully believing in what we do, having autonomy and the ability to create something that could be our own, to implement strategies and decisions based on our beliefs, our core, of what makes
Mhm.
us tick,
Right.
all of those things, and then being available for my family, for my kids, and improving my own health. All of those things, they all start to stack up and add up. And so when it came time, we both, my wife and I, just had a tremendous peace that it was time to take this leap of faith.
Mm.
At the time, I was 40 years
Yeah.
old, and like I said, I had 20 to 25 years of potentially extremely high income potential in that model. But it was one of those deals where I felt like if I didn't do it, I may
Mm.
never do it. And I was young enough, I think, as well. I mean, that's kind of one of those deals you think about it. You're like, hey, if we go belly up and I have
Right.
to file bankruptcy, by 45, at least I'm not, not going to be able to re-enter the workforce.
Yeah.
So, I mean, it was kind of like, you know what, it's now or never. And we know what we believe in and we know what we want to do, what's holding us back. And then the other thing I would say that really was, probably most influential is just for me personally was I did genuinely love the people that I worked with,
Mm.
and not all of them, of course, that we have to be real, but I love being an advocate and a resource for that bedside nurse, for that, respiratory therapist, for that housekeeper. I genuinely and truly, and during COVID was a perfect example. I actually feel that I was a voice for many people who didn't have a voice. And that was
Mhm.
one of the most stressful periods imaginable as a healthcare administrator. We were building, emergency plans to increase the capacity of our beds by 30% as a, state requirement. We were, furloughing and laying off people, and, we
Mhm.
were having supply shortages and all those types of things. I mean, there was periods of time where my wife left town with the kids for, 7, 10 days at a time because there was no point. They weren't going to see me. And so going through that process though, I felt many times, that I was able to be an advocate for the caregivers, who
Mhm.
were putting their lives at risk, at that time, which like they do every day. They put their lives at risk and their own health at risk. And so leaving that, and knowing that I had the potential to impact healthcare for that state and for that region, and partnering and collaborating with great people. That was really, really hard. The What made it a little bit easier was I know that there were just as many or more people frustrated than me that were in that environment. And so I didn't get a lot of people saying, "I can't believe you're doing this." It was, well, actually, I've had a dream to do my own business of XYZ, and, I don't know if I can take the risk and don't want to do it. And,
Yeah.
through conversations, actually able to encourage them and be, maybe somebody who,
Right.
they can look to say, well, you know what? Jordan did it. Maybe I can do it. And so that was actually kind of fun. And so again, even people you would never expect. So the website thing, that's hilarious, but the announcement that my organization sent out, was that I was, leaving to, work on my family business, which is, I mean, it was true,
Right.
but they said in Arkansas, and so everybody starts, kind of Googling Jordan Cash, Arkansas, I think. But I mean, I had advanced cardiac, advanced, kidney, liver transplant, like, leadership come to me and be like, "That is so cool what you guys are doing. I want to learn more about that. That's how healthcare should be." Like, and to me, it was like, whoa, like all this time I felt like I've had to hide, what we've been working on and what we want to do, to stay in that lane and stay working in the system. And underneath there was like this like momentum and, excitement from people that I had no idea. And I would love to have talked with them more about it along the way, or even after. But, at that point I'm on, limited time.
Right.
But
Yeah.
I've kept up with a lot of people who have reached out. I talked to somebody I worked with for years, just a couple weeks ago, and they were saying, "When are you coming to Oklahoma City to open one of your locations?
There you
Uh,
go.
we want to come work for you, and we want to do this." And I was like, "Man, that's pretty cool."
Mhm. Yeah, that's awesome. Jordan, tell me a little bit about going from large health system leadership and what you thought leadership was in that system to now leading a direct care organization, completely flipping the script in terms of the mission of your everyday.
Yeah, so I mean, to me, leadership is always about, like people, right? So I mean, I always wanted to invest in people no matter where I was, whether it was in that large system or now. The real shift to me has been in the mindset of education and connection with the community, with the customer, our country. That sounds like extreme, but I love to talk now about the difference between perceived value and real value, and like what you're getting for your money in this traditional system. Um, the disincentivation that exists for people with insurance to actually seek out care until they've met their deductible or met their out-of-pocket maximum
Right.
is something that's it's just not talked about enough. But everyone's like, "Oh, I have insurance. That's great." But if you have insurance, but you never actually, seek care or try to be proactive in your health or try to, at first signs and symptoms, seek that care, then what do you even have the insurance for? So most people treat insurance as a true catastrophic insurance.
Right.
And so to me, the mind shift came and that leadership shift came when I began to say, we can actually give people something that's valuable. And in the direct primary care model, you pay a monthly or annual fee and you have access to a physician or team, and you don't feel guilty or you don't have this enormous financial burden, or fear or anxiety of what the cost is going to be or what the problem is going to be. You can quickly, seek out and begin engaging with your provider or your team, and it becomes encouraging, it becomes proactive, it becomes a part of your routine life where you're attacking preventative health in more than just words. We talk a lot at the national level about proactive health and preventative health, but the system still doesn't really
Mhm. That's
incentivize
right.
that. And so when you have that misalignment, you are never going to get the outcomes that you really desire. And so the direct primary care model created an opportunity for me to fully believe in what I was a part of. And for us to say, you know what, I can look a customer in the eye, a potential patient, and say, our customers who work with our medical team at Salt Health and as our direct primary care clinic, they actually get better. They
Yeah.
enjoy life more.
Yep.
You know, they're out on the, hiking and biking trails more. They're enjoying their
Yep.
grandkids more. They're playing in the floor with their children more. They're not concerned, every day stressed about what might be going on in their body with health because they actually had lab work done for the first time in 5 years.
Yeah.
And so there's so many cool things now that it's easy to get passionate and it's easy to want to encourage as many people as possible to discover the power and the value that is there for people who enter the direct primary care world.
Yeah. And Jordan, that's so awesome because, there's study after study after study that shows people delay care because they're concerned about the price. They don't know that they can afford it. They don't know how they're going to afford it because of that fear. And that's one of the things I love about direct primary care is that you don't have to have that fear anymore. And to that point, what do you see as the biggest challenge for you right now in helping people change that mindset? You talked about that own mindset for yourself and making that shift. What's that biggest challenge to help people understand, man, this is where you need to be because this is where you get care better?
Well, I'll tell you, it's the challenge is real, but it's getting a lot easier. And I'll give Troy, you and Dr. Bushman a lot of credit because people like you are really frontiering and pioneering, this and making an everyday topic. And direct primary care is growing immensely. 6 years ago when we started Salt, every single person who came in who was like interested in our services, legitimately 9 out of 10 would say, "What do you mean you don't take insurance?"
Mhm.
I mean, and it was kind of those deals. It was like, well, there was so
Yep.
much education that occurred. Now we have a full practice. We have a wait list. We're recruiting another physician. We're partnering with other physicians to, expand our model. And I would say 19 out of 20 who come in, I say, "Hey, we're direct primary care. We don't take insurance," and they all go, "Oh yeah, we know, yeah." So there's only 1 out of 20 versus 9 out of 10, and
That's
so
great.
once you really infiltrate the market and educate, it can turn quickly. The beginning was definitely a challenge,
Yeah.
but I love to give the example too. It's a little bit corny, but it's like you know auto insurance is just a great example to me.
Mhm. That's right.
Everybody has to have auto insurance, whether it's liability or full coverage, but you really only use that insurance if you have a wreck. There's a couple other examples, but if you need to like replace an alternator, if you've got to replace your tires, if you all those things are really expensive. Like it's not cheap to do. You just have to pay out of pocket to do that. I really think that this model for healthcare, when primary care is treated as a separate thing from your insurance, the patients win. That's the name of your
There you
podcast,
go.
right? So, I
Absolutely.
mean, it's one of those deals
Yep.
where you actually can say to yourself, okay, I know I have, a catastrophic or emergency plan. And I think everybody should have some form of insurance because that uncertainty is a killer. It's a high level of stress, all of those things. But the value that you're going to get in a true engagement with a direct primary care practice, with that that small investment on the side up front, is going to reap such benefits for years, for decades, and for truly generations. And so it's easy to get passionate and excited about it. And I love, tying in again that value piece and that comparison to how other systems, programs, insurances work, whether it be home, auto, or heck, there's pet insurance now. And so,
Yeah.
you can quickly go to an urgent care and drop $300, and a lot of direct primary care practices that might pay for 3 months membership. And so which would you rather have, an actual engaging team and provider who knows who you are and knows your history, and that I can call and I don't have a copay, deductible, co-insurance, office visit fee, all of those wonderful things. People just don't know about it enough yet, but there is a rising trend and awareness that is incredibly exciting, and I love being a part of it.
Yeah,
It's
that's
awesome.
awesome.
Yeah, and
Well,
then
earlier this week, yeah, go ahead, Jonathan.
no, I was going to say to Jordan's point, decoupling primary care or essential, health maintenance from insurance is something I've talked about before. It doesn't mean we don't pay for it, but does it need to be insured? Is it truly a financial risk to have primary care? No, it's actually the opposite. It's a financial risk not to have primary care.
100% agree. I
And,
love that.
and I had some leaders in my office last week, and about 50, a group of 15, and this highly intelligent, very engaged young attorney. About 15 minutes in, he raises his hand. He's like, "I'm sorry, but like, I guess I'm not getting this. I don't understand what do you mean by direct care provider? What does that even mean?" And I said, "Well, you use your dollars to pay us for professional services directly." He said, "Okay." I said, "Well, rather than giving them to a third party insurance company who then comes and gets a contract with me so that when I see you, I can bill them to get return payment from the dollars that you originally gave them." Yeah, that makes sense. And then his next question, which I loved about 5 minutes later, is, "Well, why aren't more people doing this?" And I said, "Because they're right where you were 15 minutes ago, scratching their head, wondering, how does this work? And when simplicity seems suspicious, we have a problem, right? Like, it's just too simple." But, that's I love that story because when you put it in plain words for people, it actually does make a whole lot of sense. We've got a lot of work to do on the policy side, and to finish up here, Jordan, one of the things that whether you see it or not, what I see in you and what I hope for you in your future, both in direct care, but also given your background, is that you can become a bigger voice in this movement. And the reason being is you have such a unique perspective and set of skills that can speak very loudly to the right people, the policymakers, the insurance companies. You've been in those conversations before on the other side. You know what didn't work. And like say, I know you have that in you. I would love to see that. Your story matters. Continue telling your story. And I
Right.
want obviously the best for you and would love to be a part of the journey with you.
Wow. Again, I appreciate the opportunity to join you both today, and absolutely love what you are doing. And I actually applaud you. You guys have been very active in that space. From a policy standpoint, and from a impact in a large free market society for healthcare advocacy. And again, I think it's one of those things. I know that I need to, and would be happy to get more engaged. Part of the reason we left was to get away from some of that red tape, and I hate, the slow moving, you mentioned earlier, it was a great compliment to me, as I've actually, never heard you say that, and was grateful. I took it to heart. You saying that I actually, like, said no, and I had really cool story, just quick. When I was an administrator, in that fellow resident role back in North Carolina, I had an administrator. I told him one time, I was like, "Man, I love working with this physician. He's a lot of fun. He's blah blah blah." He goes, "Have you told him no yet?" And I said, "No." He goes, "Come back and tell me how much you enjoy working with him after you told him no." And so, it was one of those. It stuck with me. It was early on. I was so young, but it was one of those deals. I thought about it. I was like, "Oh, okay." So as I look at it, I hate going to people like policymakers and different things, and "Oh yeah, we need to do this. Oh, let's, we'll," and then it's crickets. Then it's,
Right.
oh, they move on to the next thing, and they have no intention of actually doing anything. I don't like fake. I like to be real. I want people who really want to make a difference. I'll partner with you all day long. But in that environment, that political environment, I've
Right.
actually enjoyed distancing myself from some of the politics after 15 years in healthcare administration and working with policymakers. But I do recognize that is something that, is a call, and that I need to be more engaged in moving forward, especially in this new model and leveraging my experience. So I appreciate the encouragement, but I also
Absolutely.
thought it'd be fun to share, kind of that backstory as to why.
Right.
Yeah. Well, again, Jordan, you're not anti-hospital, nor are we. We are absolutely pro-patient and we're pro-honesty. We're bringing these necessary conversations to the table, to the forefront. And I know that you never left healthcare. You found it,
Yeah.
and you found it in a place that your passions can run wild every day. And I'm thankful for that for you, thankful to be a part of the journey with you. And at the end of the day, we ask the question always, did the patient win? And I love that your day starts and ends with that mission at hand. And thank you for doing the hard work that you do.
Yeah.
And thanks
Well,
for
there's a whole
joining
lot of
us.
patients in Arkansas where the patients are winning now because of Jordan and his team. So that's awesome.
Uh,
Absolutely.
yeah, thank you guys. Yeah,
Yep.
enjoyed it very much.
Thanks again for coming, and thank you for enjoying the show today. Stay tuned for our next episode.